Hi, everyone. Thank you so much for joining us today. We are here with Dr. Motylewicz, and we are in honor of Autism Awareness Month. We invited her to talk to us about motor impairments in children on the spectrum. Dr. Motylewicz is a doctor of behavioral health and a BCBA, and she's a specialist in integrated care, and she has a lot of experience with motor impairments with kids on the spectrum. Dr. Motylewicz, would you please introduce yourself, talk a little bit about your work?
Hi, Dr. Rocha. Thank you for having me here. I'm honored to talk about the area of motor impairments and autism here with you. Yes, I'm a doctor of behavioral health. I'm also a board certified behavior analyst. I have been working with children on the spectrum for many years, and I'm implementing integrated approach in my sessions. So I know that we are going to discuss motor impairment specifically today. So I prepared some slides for that
That's great. Thank you.
presentation. So let me just share my screen.
Thank you. Wow, those are beautiful slides.
Thank you. So, as we all know, ASD has multiple comorbidities. I'm not going to really discuss all of them today. I just want to point out to a few very prevalent, which is ADHD, ADD, and anxiety. But motor impairments are usually not something widely discussed, and we don't see a lot of mention of motor impairments in literature. However, motor impairments and ASD started to get some attention in clinical work and in the research area. And we know that motor impairments affect muscle weakness, muscle tone, which leads to many different abnormalities: motor planning, gait, balance, coordination, and speech production. So as we know, all those impairments, as we see in that slide, are very closely connected to symptoms of ASD. So when we look closer at affected areas, babies at the very early age should be able to reach and point to communicate, and that's affected and impaired. They have problems with object manipulation, which in long term leads to affected play skills. Overall, they have impaired gestures and impaired coordinated movement. So we're going to see children who have difficulties jumping, throwing a ball, kicking, and impaired fine motor skills, which will be really affecting handwriting, shoelacing, buttoning, all those things that affect the use of hands. So our focus in ASD is really social communication area. And this is where my focus is, because motor impairments affect social communication area. So there is a few research studies that I identified for that reason. There's a growing evidence and a growing interest, a research interest in that area. However, it's still very limited. So overall, everybody agrees that motor component is overlooked. Not too many clinicians look at motor component as an indicative of ASD. Motor impairments may be key neurological components, and the majority of focus is placed on communication skills, while in fact, communication skills can be just the tip of the iceberg in that area. So motor impairments are so prevalent in ASD that some researchers at this point think it could be one of the main indicators early on in ASD. And of course, some of them are going to point to more neurological dysfunction, located in the cerebellum. And we know that that's going to affect fine motor skills, which is like also very prevalent in ASD. And of course, we're going to have later on a combination of different factors that affect motor development overall.
Dr. Motylewicz, if I can interrupt you for a minute, if you can go back to the previous slide.
Yes, of course.
So you mentioned here that a motor component is overlooked, and perhaps these could be signs and red flags for the screening of autism. Is this something that pediatricians are aware and are tracking in infants? Are you aware of that?
It's a very good point because there are specific screening tools that the pediatricians use right now. However, there are no screening tools that link motor impairments with social communication deficits. So this is something that I was looking closely at, and that led me to really looking at different screening tools and looking at like how autism is diagnosed, which is like pretty standard right now, and what is the correlation of impairments and gestures and the social interactions, and that's pretty well established. However, there is nothing at this point that really links these two from the purely motor impairment angle. So that could be, in fact, the emergence of social communication and social interactions problem in general, because children at the very early age communicate through their bodies. And like if that's affected, then all other areas will be affected as well.
So would you recommend that if parents notice those motor impairments, they should ask for autism screening?
That's my hope that that's going to happen because we can really identify children at risk of autism early on. And once those children are identified, we can implement different approaches than like traditionally are used at this point. So for that reason, I developed some training protocols and like also like assessments that link these two areas, social communication area and like motor area. So I would like to discuss that a little bit, and it's still in the process of validation, so it's not really publicly available due to like copyright reasons. So I'm going to focus on the training modules a little bit and the motor impairments of autism, which is called with this cute name MIA because it's the abbreviation, and the functional training protocol. So my goal and the purpose of developing clinician training protocol is because we have that gap where motor impairments are really treated like as a completely different area from social communication area, and these two have to be linked, and the clinicians have to be trained. So it is an evidence-based approach, and it addresses physical delays and motor impairments in the context of core symptoms of autism. And according to many researchers, functional training in general is able to bridge the gap between the rehabilitation and performance. And there is a very close relationship between neuropsychological and biomechanical principles affecting motor disorders, which is very obvious in children with autism, because that affects like so many different areas that are really linked to biomechanical principles. And this is a bidirectional result of like muscle coordination and central nervous system. So like once we're going to stimulate one, the other one is going to improve, and the other way around.
Could you give us some examples of those areas that are linked to biomechanical principles?
Yes, so for example, if we have a child with a speech delay, we typically look at the speech delay, and we don't really look at biomechanics of speech delay. So when we are going to stimulate appropriate muscles, and it's not only oral motor muscles, as like most people think, we have to focus on different areas in the body, which we function as a whole. It's not that speech is only like limited to our face and our mouth. So by stimulation of those other areas, we are bidirectionally stimulate also like affected area. So a child who is going to have his or her gross motor area improved is going to also improve oral motor area, which is going to improve also like central nervous system functioning, and that is going to affect by like it's like going in circles with affecting one area when that area is going to go back to affecting the first area, pretty much.
Okay, I understand. Interesting.
So this is the motor impairments of autism, MIA, the assessment based on which we can really look at three major areas that I identified. And it's an evidence-based assessment.
This is an assessment that you're in the process of developing, or?
Correct.
Okay.
Correct. It's pretty much developed. It's just in a process of being validated.
I see.
So I identified three major areas like social motor, communication motor, and play motor. So I'm not going to really go over the scores because that would require me going over specific items. But the point of scoring, and the reason that I would like to discuss that is just like what it measures and why. So it is a very, very detailed assessment, and it's going to look at the probability of a presence of motor impairments affecting one of those areas and all of those areas combined. So sometimes we do not link specific weaknesses in children to how it can affect their, for example, social area, or how it's going to affect their play skills, or how it's going to affect their communication skills. So that scoring, that assessment is going to look at how those skills are affected by motor weaknesses, pretty much, in general.
This is a very comprehensive test. I'm looking at, just for social motor areas, you have 96 items that you score, 134 for communication and motor area, 84 for play motor area, and it's a total of 945 points that you can score. But it's many areas. It's almost 300. No, it's over 300 items that you are scoring. So this is very, very comprehensive. Like in my mind, I'm not by any means a specialist in motor impairments. I would never think of looking at 300 different things to assess that impairment. It's
correct.
Amazing.
And most people don't look at that this way. However, if you're going to only think about responding to the name as a very simple task, it's not. It's a very complicated area because it involves motor movement of the head. It involves like visual tracking. It involves responding to the source of sound. It involves like a spatial awareness of the body in space. It involves so many different components that if we're going to dissect it and we're going to look at each one of them separate.
Yeah, hold on. I think I lost you for a minute. Can you say something? I think I lost your sound.
Okay, what about?
That's better.
That's better. So it was
Thank you.
yes, I think I was having some internet connection issue. Sorry about that. So if we are going to really dissect that, and we're going to look at each sub skill separately, we are going to see that it's not so simple. It's a very complex task, and sometimes addressing those like sub issues can lead to a significant improvement of those like core symptoms. However, for that, we're going to need to see what's the problem. And that's the reason I developed that assessment.
That's amazing. In which setting do you think that it's okay? So I'm gonna leave the question for next, because I see your next slide is probably answering my question. Go ahead. I'm sorry.
It's okay. So it can be used in many different settings. My hope is that like it's going to be a standard screening tool one day somewhere, like at each pediatrician's office. It's definitely like it can be used in any integrated setting. It can be used by trained clinicians who will be able to screen and then apply a training protocol for that. So the intake, assessment, and implementation of functional training would be the order of like how I thought of that. And depending on the score on the MIA, it would be either like I called it a boot camp, like very intensive training for many hours per day, intensive, moderate, and then mild, depending what is the correlation between the MIA score and the red like flags of ASD.
I see. That's
okay, so I hope I answered all the questions, but like I would like to clarify things even further, like if you have additional questions.
Yeah, I do have a few questions. So when you mention this protocol, it seems very intensive with over 300 items. What kind of training or what kind of education requirements a clinician needs to have to be able to use that assessment?
So it first of all, it's addressed to already practicing clinicians. So it's not going to be addressed to providers who are paraprofessionals. I mean, it would be really beneficial for them to have that knowledge, but the implementation of the MIA and the protocol would be probably mostly restricted to practicing clinicians, such as PTs, OTs, speech therapists, Bcbas, and doctors of behavioral health. And I'm hoping that one day we can really implement those screenings at the pediatricians' offices, because that would allow to identify children at risk of autism early on, because those symptoms that I'm discussing in those assessments, I can see them in very young children. So the protocol right now is that like children are being diagnosed with ASD the earliest like at 16 to 18 months old. And that protocol can really screen children even younger than that.
So this is an interesting thought I just had. So children who are being diagnosed that early at 16, 18 months, they usually are at the most severe end of the spectrum. But what about those motor impairments? Are they present also on the individuals who are at the lighter end of the spectrum? And it would be easier to catch them, to catch that red flag and act upon it sooner if we use that spectrum? How's that relationship?
Yes, and that's exactly the idea, that sometimes those children who present like with milder symptoms are simply overlooked. And they sometimes are being assessed by psychologists, and they do not meet the cutoffs of ADOS, for example. So that protocol would allowed to really identify those areas. And even the child who's not even diagnosed, we can still work on it. So it can really address those like issues early on, even without an official diagnosis of autism. So that's like my hope that we can get to that point.
That's wonderful. Let's say if somebody is a practitioner and they run a practice, pediatric practice, and they would be interested in collaborating with you in using these assessment and the protocol for treatment, how can they get in touch with you?
They can email me. I'm in the process, like I mentioned earlier. It's pretty much a complete and like fully developed assessment and functional training protocol, and also the protocol for clinicians. So I'm going through the process of validation at this point, and going through the more like legal things as copywriting and trademarking. So,
Sure.
but overall is like everything is complete and ready to be launched.
Sure. So then perhaps I could add your email to the notes for this video so people will have
Yes,
access to your email. I'll just write it down and put it in the notes so people can include it later.
yes, thank you. I'm doing this right now in the chat box.
Sure, great. That way I can, yes, I will add it to the notes so that everybody can find the correct spelling and, and be able to get in touch with you. Also, what I was wondering is this, from what you described, is a very vast area of knowledge and an area that has a huge impact on the running of behavioral programs. And we are both Bcbas, and I'm wondering, so I'm thinking back at my training, when I was in training to be a behavior analyst, and when I was in training to be a doctor of behavioral health, I did learn a few things about autism and comorbidities and things like that, but I never heard, other than from you, about the impact, that we as Bcbas can have in the treatment of motor impairments and how those motor impairments can affect the programs that we run as behavior analysts. Would you please talk a little bit about that?
Yes, so I went through the same training as a Bcba and as a doctor of behavioral health, so I know exactly what you're talking about. So because of my interests in that area and my background as a former athlete, like my attention and my passion was always on motor skills, and I have been working with children in general for so many years that like I not only was looking at them from the clinical perspective, but I made like so many different observations with them throughout the years, over 20 years. So there are specific areas that affect daily living skills in children. And this is a huge area, also like play skills, which is also like very important area for children at this age, that most of the time we don't pay attention to how motor skills affect those areas. We just know that the child is not able to hold the spoon, or the child is not able to play with the blocks, or the child is not able to really show us anything in the context of like really like joint attention or like even like play skills. But we don't really think about that these are the motor skills and motor impairments that cause those issues sometimes. Mm-hmm. And as Bcbas and as doctors of behavioral health, I think that it's really important to us to go to the root of an issue, because we have to address really an underlying problem. And for that, obviously, we have not really had any training how to address motor areas, because that's usually a PT is going to do that, or OT is going to deal with hands. But if you're going to look at that from the holistic perspective, it's not only that the hands are hands and like the gross motor skills are gross motor skills. This affects everything else. So we should be able to look at that and like learn those like special protocols and know how to address those. So for example, like if motor areas are affecting play skills, that's something that BCBAs and like doctors of behavioral health are concerned with, because it's a huge area and it's like an area of concern for us, like play skills. But by knowing how to implement those protocols, we are going to improve that area much, much faster.
Mhm.
So I would say going to the root of the problem would be the idea, where not only admitting, yes, the child has communication issues, right? Why a child has communication issues would be like the question
Yeah.
to ask.
So I'm wondering, I've seen situations in which, a child remains for an extensive period in one particular skill and has a hard time to develop. And I'm wondering, many times I've seen people that I supervise, I've seen them saying, well, there's a huge amount of escape. The child is engaging in behavior that's escape maintained or escape motivated. When listening to you talk, I'm thinking of situations, and those could be simply motor impairments that we don't recognize. For example, imitation skills. There are certain aspects of imitation skills that require, good development of motor skills. And many times we don't catch those things because we are not, in tune. I remember a particular case of a kid I was working with that we were working on imitation skills, and we asked the kid to do these airplane arms, and he would never go above this. And because I knew you, and that thing was in my radar, and I asked the parents to try doing this imitation skills in the pool, on the water, and in under the water, the child was able to lift arms all the way up, but not outside of the water. So do you have any tips for BCBAs who might be seeing persistent escape maintained behaviors that could be related to motor impairments, how to recognize that and what to do after they recognize it?
Yes, so that's exactly why I developed my program. It's not a simple solution to that, and not like I'm going to be able to answer like with like one simple answer. So this is something that requires like knowledge in the area of MIA and like the
Mhm.
implementation of that. So it's a perfect example that you gave, because I see children with those issues all the time. That would allow to identify the the core problem. I would name that like this, and have a specific score, and then implement appropriate procedure, which is also like developed in my functional training protocol.
That's amazing. But for those of us, while your protocol is not widely available, if they notice something like that, what kind of behaviors should they say, I think this is not just escape, this could be motor impairment? Could you give a few examples of things for us to be like on the radar, that it's not just escape, could be something else?
Yes. So for example, sitting at the table is like one of the main issues that children are having. So, for example, a child who's going to slide under the table all the time, and I've had cases like that where a child would have like special accommodations at school like with the special chair, because like according to the school, it was the sensory issues and escape and like all sorts of like different issues that they identified. So after I implemented my assessment, I identified core muscle issues. He had a very low muscle tone, and then like I referred the child to a specialist in that area. It was confirmed. So he was not escaping. He just couldn't sit long because of his like weak core. So in that case, like by only looking at his behavior at the table, you would say that the child cannot pay attention for longer and like he escapes. But in fact, it was not an escape. It was just like weakness in his core area.
I see. That's amazing. So for those of us who are not specialized in the MIA yet, let's stay tuned and always, now have that as another possible motivating operation for those behaviors.
Exactly. And like I'm really happy that you named that with our specific vocabulary that we use, because sometimes we have to look at setting events. And those are in many cases very unclear to us, because simply by identifying the antecedent in that moment, it does not show us the whole picture, because the root of the problem is sometimes somewhere else.
Yes, and also I think that there's a lot of room for us to improve on the conversation with other disciplines, for example, OT, PT, because those are areas that, like you said, we are siloed. We work in silos. The OT will do one program, the PT will do another program, the Bcba will do a third program, and there are some issues that are prevalent in all three areas, and that we need to integrate and coordinate better, which is also, let me raise my flag again. It's the space for integrated care in which we finally look at the individual as a whole, not just a producer of behavior or a producer of symptoms, or somebody who needs medical treatment from the neck down or from the neck up. And we need to really look at the person as a whole. So.
I completely agree, and like it's a very correct observation that yes, we work with other professionals and we work like in teams. However, we do not integrate our approaches.
Yes. Well, thank you so much for your time today. This was amazing. I hope that you who is watching, that you really took something from this and gained some knowledge. And because of the setting we're doing this has to be superficial and brief. But if you want to learn more about this protocol, you can check the notes and see Dr. Motylewicz's email and get in touch with her. And I thank you so much, Dr. Motylewicz, for being here.
Thank you so much,
This was amazing.
for having me.
This was amazing. Thank you.
Thank you so much.